In Russia, the disabled are still among the most deprived groups in society. They struggle to survive on minimal state social security, while the big cities rarely provide even the most basic facilities to care for their special needs. It's difficult to feel valued or appreciated in such a negative climate. Worst of all, parents live in fear that once they get too old or sick, their children will simply be institutionalized. That's why the program promotes maximum development, so these children can someday live independent lives. And in an update to a story we brought you a few weeks ago, separated Siamese twins Ganga and Jamuna Shrestha are going home to Nepal. The rare babies underwent a 97-hour operation at Singapore General Hospital to separate their skulls. Jamuna, the stronger of the two, is learning to sit, while Ganga is gaining control of her head but has difficulty fixing her vision. The babies have not suffered any major strokes, brain swelling or infections, according to Professor Ho Lai Yun. Dozens of well-wishers, doctors and nurses were at the airport to bid them farewell. The twins and their family spent more than a year in Singapore and will return one day for more reconstructive surgery. After an emotional and thankful scene, the twins, their parents and grandparents left for Kathmandu. There they'll stay until the girls are healthy enough to return to their distant home village with only scant medical facilities. In stark contrast, a beacon of hope shines brightly in New York City. The Montefiore Children's Hospital offers the latest technology and surrounds to help youngsters deal with what can often be a scary experience. Movable computers allow healthcare providers to take notes more easily and ensure that proper medications are prescribed. The kid-friendly environment encourages patients to learn as well as heal. The lobby highlights the building blocks of life, and each ward has a theme. The playrooms and ceilings keep the mood bright, while a mural with daisies and a farmyard hides scary-looking equipment. But for kids, it's all about that big TV. Best of all, any child is welcome at Montefiore. That's why it's situated in one of the roughest neighborhoods in New York. The high-tech wonder can turn an often terrifying experience into a time of wonder and exploration. Robert Schmidt is one of an estimated 500,000 Americans suffering from the neurodegenerative disorder Parkinson's disease. Researchers say the disorder is caused by a combination of factors, both environmental and genetic. But new research in the latest issue of the Journal of the American Medical Association suggests a link between Parkinson's disease and another neurodegenerative disorder, Alzheimer's, via a protein called tau. Doctors at Duke University Medical Center believe they've found the connection on chromosome 17. Unlike the abnormal deposits of tau found in the brains of Alzheimer's patients, Vance says there's no abnormal tau in Parkinson's patients. Instead, researchers are finding a rather common form of protein that increases the susceptibility of developing late-onset Parkinson's disease. Duke researchers have also discovered 5 new genes linked to Parkinson's disease and hope the latest discoveries will bring them one step closer to finding a cure for the debilitating disease. Scientists at the University of California have developed a new way to detect changes in the brain before symptoms of the devastating disease begin. They believe it will revolutionize the way Alzheimer's patients are treated. During testing, a patient is injected with a new chemical which seeks out abnormal deposits in the brain. The patient then enters a PET scanner which shows where the chemical has accumulated. The technique is still undergoing clinical trials, but the potential benefits for Alzheimer's sufferers are huge. Dementia-related diseases affect more than 30% of people over the age of 80. Doctors hope that this breakthrough will lead to new forms of treatment and potentially even a cure. And while we're on the subject of aging, could a simple pill help men go through the infamous midlife crisis? Some doctors now say the midlife change is caused by dropping levels of the male hormone testosterone. This would mean that men go through their own form of menopause, called andropause. Some doctors offer patients testosterone replacement therapy to fight the symptoms of andropause, such as mood swings and osteoporosis. However, other doctors, like psychiatrist Dr. Thomas Wise, say that andropause is not a biological stage of life like menopause, but rather a psychological phase. Testosterone levels drop in men starting as early as age 30, and by age 70 can be half the level found in young men. The testosterone drop is blamed for what was once thought of as normal aging: muscle weakness, sexual dysfunction, weight gain, fatigue, and even high cholesterol. Dr. Wise says that aging is a fact of life, one that may not be alleviated with a simple drug treatment. Rather, he prescribes regular checkups, a healthy diet, and exercise.
Okay, good.
They say it's never too late to learn a new trick. And Robert Van Cleve is living proof. At 77, he's become a bona fide surfer. Web surfer, that is. Research has shown that isolation and consequently depression are high factors in elderly mortality rates. Many nursing homes are broadening their patients' horizons by getting them online to research healthcare or chat with other internet junkies. Special keyboards are easy to read and easy to use, building confidence and alleviating fears. Robert researched angiograms before he underwent one. He also surfs the net to learn more about his medications. Doctors caution that not all of the 17,000 health websites are credible. There's little regulation on the industry, and some information may be downright dangerous. Everyone, no matter what age, should view online health information with a discerning eye and always check with their doctor. Today's seniors have seen a lot of change in their lifetimes, from radio to the internet. Going online is just the latest way they can stay engaged without leaving home.